Welcome to the Oral Health Podcast, where we are having bite-sized discussions with different people across the globe about all things oral health. Today we are talking to David Withers, whose father sadly passed away from mouth cancer in August 2021 after receiving his diagnosis at the start of the pandemic. David shares with us how his family coped with his father's diagnosis, what the treatment process was like for his dad, and any advice that David has for either family members who are supporting someone who has a cancer diagnosis or for anyone going through treatment themselves. It's a brilliant conversation and I hope that you take something away from it. So, David, would you like to just take a second to introduce yourself?
Hi, my name is David. I'm based in Cornwall, and my dad recently had oral cancer.
And so, what were the first things that your dad noticed when he noticed something wasn't quite right with his mouth?
So Dad didn't really know anything about it. He just went for a routine dental appointment, and it's from there that the dentist was a little bit concerned about some white dots that he had in his mouth. So did some biopsies and things like that. And then after a few biopsies, he was then referred to the maxillofacial team, where he was diagnosed at the beginning of lockdown with oral cancer. Yeah.
And what was that diagnosis process like? How did he find that?
Dad was very positive. He was an amazing man. He really was a positive person, and he strong-willed. He was not going to let this. He was going to fight this every step of the way, and he did. He literally fought all the way. He was not going to give in. No, not at all.
Yeah, sounds like a strong-willed person.
Yeah, he was. He was. Some say stubborn, but you know.
And so when he got that diagnosis, what then was discussed with things like treatments and ways to try and combat the cancer?
So the first thing that they wanted to do was to do an operation, and it meant a lot of skin grafts, and he was going to be in an operating theatre for quite a while.
Mm-hmm.
He didn't want that operation. He just, if there was any other way he could get around it, he just did not want this operation. And this was right at the very start of lockdown. So, he was a little apprehensive of that. But just by chance, the surgeon on the day, his car broke down, so Dad's operation was cancelled. So it was then decided that he would go straight in for radiotherapy. So that kind of made Dad's day, really. He wasn't too keen on the operation. He would have been a long time in ICU. With COVID, it was just too dangerous. So I went through a course of radiotherapy, and then he then went on. That didn't kind of work, so he then went on to for chemotherapy and things like that. But we tried to make it as fun as we could for Dad. So what we did is every time he had a chemo or radiotherapy session, we bought him some scratch cards. So when he got home, he would scratch one, a bit like a countdown, really.
Mm-hmm.
So, yeah, it just makes it a bit of fun, doesn't it? To make it, like I say, it's a bit like a countdown to Christmas, isn't it? You've suddenly got something to look forward to.
Mm-hmm. No, absolutely. That makes a lot of sense. And when you're going through things like cancer treatment, having those little things in your day to look forward to, it can make all the difference, definitely.
Definitely, and at the end of it, he had all his little winnings that he was gonna to have a treat from at the end of the day. But sadly, he didn't cash them in quick enough. So when he passed away, my mum and I went for a meal on my dad.
Oh, bless him! Spend the winnings in a different way.
Yeah. Well, he loved Bath Rugby, and he was a massive supporter of Bath Rugby, and him and his friend used to go every match, a home game. They would always go to have ham, egg and chips, because they worked out that was the quickest meal that they could get to be able to get to the match and get the best seats. So when he passed away, we went out for ham, egg and chips with his rugby buddy. So it was nice.
Yeah, sounds lovely. So if you're okay with it, can you talk a little bit about the treatment that he had, how the radiotherapy went, how the chemotherapy went, and his experiences with it?
Yeah, Dad, he did really well with it, and he had a PICC line in, so he was fed via tube. But for most of the sort of the 18 months, he tried to eat as much as possible without that tube. The day that they tried to take the tube out, his mouth was too sore, and he couldn't open it as wide as what they wanted to do, all this, to get the tubes in and things like that. So again, it was decided, Dad was like, well, it's not doing any harm there, just leave it there. And actually that was probably the best thing, because not long after, with the chemo, it really affected his appetite and stuff like that. And he could only eat via his tube. So that was the only source of food, and you always felt guilty when you went, because obviously we had to eat as well when we were with him, but you always felt guilty that he was having his vanilla milkshake or his mango, whichever he fancied, and you were having a nice roast dinner. But to him it was just like that was the new normality, and he just got on with his treatment, and he just was like, well, it is what it is, we'll just go with it and stuff. And he never complained about it, he never, it was just the new life, that was his new normality and stuff. And he was very determined. I think also, he had a lot of, support from, your friends and family from around, because obviously nobody could visit, there was new ways like Zoom, Teams and all of those kind of things, and just the phone calls and the letters that he received, that kept him going. And he made some really good friends with all the nurses, and he used to write them poems. So every week when he'd go in, he'd write them poems and things like that, and that just kept him going through that treatment.
That's lovely. Yeah, because one of the things we've found from talking to people, when you're going through cancer treatment or a diagnosis, and the whole journey can be quite overwhelming, of course, and so having other people around you that you can talk to and connect with, it makes a big difference. So it's very nice to hear as well, even with the impact of COVID, like you said, he had his diagnosis right at the beginning of lockdown, he was still able to get some community support and support that way.
Definitely, yeah. And I think that's the big thing, isn't it? It's you're getting the help and getting the support and stuff, and it's not just for the patient, it's also for the family as well. And there's so much support out there that you don't realize that you're actually going to need, or anything like that. And just talking to somebody, just sharing your experience and is a big thing.
Yeah, absolutely. Was there any organizations or any groups or things that he or you and your family found particularly helpful?
So we weren't actually aware of you guys until after, and I started working at a dentist. But we, up in Bristol, Mum and Dad, they had the Macmillan team that were them, and they were great. They were, my mum was unfortunately diagnosed with breast cancer during this time as well, and also had to have a hip replacement. But the Macmillan team, they just, the support that they gave to Mum straight away was amazing. And then obviously, there's a St Peter's Hospice, and they sort of got involved, at the end, but Dad wanted to stay at home. But it's just you trying to find, there are so many different organizations and charities out there that are willing to help and stuff, and they are that ear of, you can listen, somebody at the end of a phone to listen to, or just be in contact with and things. So I think it's important.
Yeah, 100%, definitely. And it's very good to hear as well that they had a good experience with like Macmillan teams and other people that helped, because it does make a world of difference when you're in that position.
Yeah, definitely.
What about for yourself? What kind of like family support or groups or anything did you have any contact with?
I mean, we had each other really, and we're all sort of based over the southwest. So mum and dad were based in Bristol or near Bristol. My sister is based near Exeter, and I'm based down in Cornwall. So we kind of just made sure we spoke to each other. We had our own group chat. Obviously, my sister and her husband and my wife and I, we all, talked between us just to keep each other going, and we tried to keep it as positive as we could because and just trying to do little challenges. So, we did a family fundraiser, which was part of Macmillan, the 40-day challenge, where we, you had to do something for 40 days around the fitness side. But it just brought us together, and it meant that it was something we could all do as a family.
Mm-hmm.
So even Dad could get involved, and Dad loved it because for the first time in years, he could touch his toes. None of us could, we couldn't do that. And he was like, well, I can do that. So it's quite nice that, he got something out of it. But we did that for 40 days and everybody got involved in the family. So, everybody from my 4-year-old niece to my 15-year-old daughter, we all did something. And that was the kind of support that we had. We didn't realise that there were other groups, Macmillan said about we could speak to counsellors and things like that. But at the time, we didn't need that. We didn't need that. I think now we do. Maybe we should have, maybe spoken to them before. But it's got to that stage now where, you keep positive, and then it's all over, and you think, oh, it suddenly hits you. It's like, I think this is one of the reasons I wanted to get involved was, if we can stop one person going through what we've been through as a family and what my dad went through, it's worth it. It's just some simple checks.
Mm-hmm. Yeah, absolutely. And it's an interesting point to pick up on there as well, of when you keep going and keep going and keep going, and then all of a sudden it sort of hits you, and it hits everyone at different points. So I think it's a good thing to highlight as well. Like, even if you get offered the support and you don't need it at that time, it's still there to access when you feel like you do need it. It's not going to go away if you turn it down at the time when it's brought up, sort of thing.
Definitely, yeah. And accept that help. If it's not through a professional, speak to your friends and things like that. It's just making sure that you have somebody that you can talk to and things like that. And a lot of the time, the focus is around the patient, but we were told, it's all about the patient, but actually it's about the wider friends and the wider family of that patient as well. And it's just being there for, if you know there's somebody who's going through a cancer treatment, just be there for them, and just, be that listen to ear, somebody to listen to, or, just do something like random, like drop them a bunch of flowers or some chocolates or anything, just it's the other people as well.
Mm-hmm. Just little things to let people know that you're there. Even if you can't physically be there, you're thinking of them, and it makes all the difference. Really, it does.
It's a huge difference. It makes such a difference, and it just brings that, that smile. The other day I went home and there was a bottle of wine on my doorstep, and I had no idea who it was from, and it just made me smile, and it made me think that actually somebody was looking out for me. And you go through those bad times and you realize who your friends are and things like that, and it's important.
Yeah. I know you've already sort of mentioned this, but is there any other bits of advice or little pieces of wisdom that you would want to pass on to anyone that's in that position at the moment, whether they are currently going through cancer treatment, or maybe their parent is, or their sibling, their child, anybody who is involved with someone with cancer?
Just make sure that you talk about it. You do, you don't hide it. Don't, if you're feeling low or you're feeling that you can't cope, try and do something positive, around it. I mean, that's why we did the fundraiser, because we wanted to try and keep things positive and things like that. So that was our thing, really. But just be there for people, just listen to people, don't shy away from it, even whether it's you're the grandchild of somebody who's going through it, or the partner, you're not alone. I'm happy people can ring me, it's just somebody that you have got to speak to, and people don't realize, when you're going through it, you don't realize how hard it is. And it's tough at times. It's really tough, especially when you're seeing that person that you're loved, that, is not the person that you used to know. At times my dad used to get quite aggressive, when we were doing medication and feed. That definitely wasn't my dad. My dad was the softest person that you would ever meet. And I went to collect his medication one day from the pharmacy, and I just got the best pharmacist ever. It was that one person who just made me realize sense, and that it isn't your loved one, it isn't that person, it is the cancer that is taken over. And she said to me, when it comes to things like your medication and stuff like that, and sometimes people forget, they're going through the treatment, they think they've had their medication. She said, where Dad was obviously having like morphine at times, he was saying, I need more. And it's like, no, obviously he couldn't because of the time. She said, just give him water. And at the end of the day, he will think he's had it and he will be calm. And it was the best advice ever, because, there was times where, he just had morphine and he'd forgotten that he'd had it. So I gave him water. He was quite calm because he thought he'd had his medication. So it's just, taking the advice and take, all the help that you can get, and don't do it alone. Whatever you do, don't do this alone.
Yeah. I think that's a brilliant message to take away from that, is going through something like that on your own. It's not a good idea for anybody, and there is so much support out there, whether you want to go through a charity or a support group, or just text a friend, ring a friend, talk to one of the nurses. There's always someone that's around for you to talk to. Absolutely.
Definitely. Yeah, and talking is the best way. If you can't talk to somebody, write it in a diary, just get it out of your system. And even if you keep that diary to yourself, just share it. It's just getting it out of your system. You're going to have some good days, you're going to have some bad days, but enjoy every day and take each one as it comes, and, and just go with it. Definitely.
Yeah. It has been fantastic to talk to you, David. I think you've shared so much that's going to resonate with so many people, and I'm really, really thankful that you've spared some time on your lunch hour to sit and talk to me about this. I think it's going to do a lot of good, so thank you.
Oh, no, you're welcome, and I'm just really pleased to be involved with you guys. And so we didn't know about you beforehand. It was only afterwards that I became aware of you and stuff. And it's another place you think, I wish I knew about you beforehand, because it could have made even more of a difference to us as a family, and just sort of doing, the extra support is, the more support you've got, the better, definitely.
In the description of this podcast, we will link to lots of helpful resources for mouth cancer patients as well as their families. If you want more information about mouth cancer, please go to mouthcancer.org or visit the Mouth Cancer Foundation's website, which is mouthcancerfoundation.org. Thank you again, David, for spending some time talking to me, and thank you for listening.